Hi, I'm Dr. Devkumar Rengaraja, ENT and skull-based surgeon from Fortis Hiranandani Hospital Vashi, Navi Mumbai. Today we're going to talk about CSF Rhinorrhea. Now we need to understand that our brain floats in a fluid named CSF. Now this CSF should be restricted to the cranial cavity. If for whatever reason, if the CSF starts to leak in the nose, then that is known as CSF Rhinorrhea. Or if the CSF leaks into the ear, then it's known as CSF Otorrhea. Now, this is nothing but like a hole in the roof of our ceiling and the water dribbling inside the room. It's the same. Now, if the fluid from the cranial cavity drops down to an unsterile area, that's the nose, then the infection can ascend to the cranial cavity and patient may land up with something known as meningitis. Now, meningitis could be dreaded. Now, the moment you have a water leaking from the roof, we need to address that and we need to seal the defect in the roof. The same thing is what we do in a CSF rhinorrhea. Now, if someone has a CSF in the nasal cavity, we need to identify the defect in the roof of the nose, that's the skull base, and repair that defect. Now, the good part is we do this completely endoscopically. So endoscope is introduced to the nose and we repair the defect from the nose. Now, there are certain advantages of an endoscopic procedure rather than the conventional transcranial where they used to cut open the head and then repair the defect. Now, the endoscopic procedures are minimally invasive. So the morbidity is less. The stay reduces for the patient in the hospital and the healing is faster. So the patient goes back home at the earliest.